Welcome back to WSAV News 3 today at 11. June is Men's Health Month, a time to raise awareness about preventable health problems, motivate men to schedule routine checkups, and break the stigma around mental health. Board-certified family medicine physician and founder and CEO of Harvest Health MD, Dr. Jamal Lawrence joins us now to talk about the top reasons men avoid going to the doctor and why it is costing them years of their life. Thank you so much for being here. You look rested after a few weeks not being here in the studio.
Thank you. Thank you for having me. It's always a pleasure to be here.
Well, it's always a pleasure having you. Before we get to the top reasons, let's talk about the stages of life that men are considered to do certain things. I know this applies to men from 15, and I guess that's not a man, that's a teenager, but from the ages of 15 to 65 generally is what we're looking at.
Yeah. And so early on in stages, you want to try to set good behaviors and to really see the importance of checkups. You know, typically people will get an annual checkup yearly if they're generally speaking healthy. From teenage to early 20s, we really want to continue to enforce that habit, as well as paying special attention to mental health, anxiety, depression, paying attention to sexual health as well. That's one of the higher ranges where we see sexually transmitted diseases, and so we want to make sure that people are using protection, are being cautious. When you get into your 30s, you're kind of transitioning a little bit more into adulthood, and so you really want to start to screen, if you haven't been already, for high blood pressure, for elevated blood glucose, for cholesterol, and you really start that in your 40s. As well. 40s is when I see a lot of people start to come to the doctor saying, hey, I'm getting a little bit older. Yeah. I just want to start to get ahead of things. But I really love to see people in their 30s because then we can focus more on prevention. As you may or may not know, we talked about this a little bit before, 45 is where we start to do colorectal cancer screening. Yes. 55, we get into prostate cancer screening, which is specific to men. So there are different stages that we really want to encourage different focuses on health, but overall, the goal is to focus on prevention and early detection.
And this same age group generally do not go to the doctor as much compared to women. And so now we're talking about the reasons why.
Yeah, absolutely. And so there are a few reasons. One that we often hear is inconvenience. And what it quite boils down to is just men aren't making it a priority. Right, and so we often say in the wellness community specifically that if you don't make time for wellness, you will be forced to make time for illness. Yeah. And so it's really important that we try to get ahead of things before you end up with issues that are worse off than if you would have dealt with them early.
Also, avoiding being vulnerable.
Yeah, and so that's one we see a lot. According to a national survey by Cleveland Clinic, about 20% of men have shown that they haven't been completely honest with their doctor when they go there, for fear of judgment, for the societal norms of men being the providers and being stoic. And so we really want to de-emphasize that aspect and focus on, if you want to be a provider, it's important that you are healthy. It's important that you are doing the things that you need to do to take care of yourself so that you can take care of the people around you.
And also fear of getting bad news, which is like, if you don't get the bad news, then you won't know how to treat it.
Absolutely, I hear that conversation. And this list, I'm focusing on men, but this really applies to women as well. It applies to everybody. We hear that a lot. I don't want to come in because I don't want to get bad news. Well, you're already feeling the symptoms. You're already experiencing something. You not knowing doesn't make it go away. And the longer you wait, the more it ends up potentially being a negative experience.
Finances also play a part.
Yeah, and so the biggest thing we hear there is insurance. If they don't have insurance, they assume that they can't see a doctor. Particularly in the direct primary care space, I've been really a mouthpiece for saying that just because you have health insurance does not mean that you actually have access to a doctor. And just because you do not have health insurance doesn't mean you can't see a qualified doctor. Yeah. And so, people really, we want to kind of decouple the mindset of insurance equals healthcare, because it does not. It's just a way to pay for healthcare. Healthcare is what you receive from the healthcare professional.
So you have another particular topic that you say is the most important.
What I've seen, I have a couple of patients in mind in particular, but even a family member as early as, or as recent as in the last 2 weeks, unpleasant experiences. And so this is one of the reasons why I went into direct primary care, because healthcare has become quite cumbersome. It leaves a lot of people bewildered, confused, with expenses that they did not realize that they would have, and a lot of times with more questions than answers. And so, oftentimes I'll get the wait time was too long, or they didn't seem like they cared about my time, or they hadn't experienced bad bedside manner, or just not understanding the medical plan or not agreeing with the medical plan. Hey, they tried to put me on meds, I don't want to be in it, nobody explained to me why.
Yeah.
And so it's really important that even though we may have negative experiences, we still need to still need to prioritize our health and find the answers that we need. In particular, with these negative experiences, what usually happens, or what I've seen happen, is that the patients just stop going. So you get a referral, you may get a scary diagnosis of cancer, the way the information is delivered, and you just stop follow-up. We send you to a referral, they can't get you scheduled, and you said, it's wasting my time, and you don't even bother to follow up. Well, I still need you to go get your heart checked. I still need you to follow up on that biopsy result. And so those are the experiences that I've had, that it's really important that we emphasize unpleasant experiences may happen, but you are still a consumer and you have the option to go elsewhere. And one of the things that I want to harp on that we don't hear too much is the second opinion. That used to be a thing back in the day, and somewhat it seems like people don't even realize that they can choose to go somewhere else if they don't have a pleasant experience.
So we're running out of time, but you do have a call to action.
Yep. And so, I want to tell everybody to go and find a healthcare professional that you know, like, and trust. Make sure that you get your annual visit scheduled, and for more information, you can follow me at harvesthealthmd.com.
Look at him becoming a professional, looking at the right camera. We see you, Dr. Lawrence. And you can find more information and see this interview again anytime by going to our website. That's at WSAV.com. You can also join the Harvest Health MD email list for more health advice and information. Right now, it's time for a look at our forecast. Good morning, Alyssa.